Launching the machine today, Health Minister Dr. Ruth Acheng said the availability of the equipment is expected to reduce the number of Ugandans who travel abroad to test for cancers such as leukemia and lymphoma.
These private facilities sometimes also refer the samples abroad for further analysis. And so the process has been very cumbersome, and by the time we get results, it is quite late to treat the patients. So having this machine here will ensure that we have early diagnosis and prompt treatment.
The equipment has the capacity to analyze one's blood or bone marrow cells to determine whether the high white cell count is the result of the blood cancer.
When our teams here analyze the samples, the printouts are sent to the mails of the various heads of laboratories in the various hospitals, and so they are able to receive it in real time and take a decision in real time.
The Executive Director of Uganda Cancer Institute, Dr. Jackson Orem, said the machine would make it easier to provide more accurate diagnosis and appropriate treatment of cancer.
Because we were using microscopes, and with microscope you cannot tell. Actually, the difference between a normal and an abnormal cell is almost impossible to tell. But this machine can actually detect the receptors on the surface of the cell and can tell, because those receptors are what define what is normal and what is abnormal.
Dr. Rem added that the machine will also make it easier for the Institute to determine more accurately how many people are living with blood cancer.
In the past has been ranging between third and fourth in the order of incidents in the country. So who knows, when we have capabilities like this one, we may have to redefine the level or their ranking in as far as cancers are concerned.
The Health Ministry Permanent Secretary Dr. Diana Twini says that they are working to accommodate private-owned hospitals that lack such equipment.
From the private, yet they charge. Here we don't charge, then people use us. No. So if people are going to, we need to ascertain that actually they are not going to charge, but I don't know how we'll ascertain. So the private, we need to discuss really.
Aaron Mukama, NTV.